So, good day everyone. So, we are going to report about the Magna Carta of Public Health Workers. Next slide, please. So, first is the policy aims and definition. So, the state shall instill health consciousness among our people to effectively carry out the health programs and projects of the government essential for the growth and health of the nation. So, towards the end, this act aims to promote and improve social and economic well-being, develop their skills and capabilities, and also encourage those with proper qualification, excellent abilities to join and remain in government service. Definition is purpose of this act. Health worker shall mean all persons who are engaged in health and health-related work shall be employed in all hospitals, health infirmaries, rural health units, and establishments owned and operated by the government or its political subdivisions with original charters, and support personnel employed regardless of their employment status. Next slide, please. Next is the recruitment and qualification. So, recruitment policy and minimum requirements with respect to the selection and appointment of a public health worker shall be developed and implemented by the appropriate government agencies concerned in accordance with policies and standards of the CSC, and that in the absence of appropriate eligibles and it becomes necessary in the public interest to fill a vacancy, so they should not exceed more or less be 3 months renewable. Next slide, please. Next is the transfer or geographical reassignment. So, a transfer is a movement from one position to another which is of equivalent rank, level, or salary without break in service. Hereinafter referred to a reassignment, then a public health worker shall not be transferred or assigned except when made in the interest of public service, in which case the employee concerned shall be informed of reasons therefore in writing, and whatsoever shall be made 3 months before any local or national elections. Next slide, please.
So, security of tenure. So, in terms of security of tenure, the Magna Carta of Public Health Workers includes provisions to protect public health workers from arbitrary dismissal or removal. So, public health workers covered by this law are entitled to security of tenure, which means they cannot be removed or suspended from service except for just and valid causes and as provided by law. So key points related to the security of tenure or public health workers under RA 7305 may include protection from unjust dismissal. Public Public health workers are protected from dismissal without just cause and due process. So they have the right to be informed of the charges against them and to be given an opportunity to be heard and defend themselves. Number two is due process. So this law emphasizes the importance of due process in any disciplinary action or dismissal. So this includes notice and hearing, allowing the public health workers to respond to allegations and present evidence in their defense. Number three is civil service rules. So the law recognizes civil service law, rules and regulations and determination of just and valid causes for disciplinary actions. So it is consistent with the principles of the civil service, which includes merit and fitness and protection against political and personal considerations in personal actions. So number four is appeals process. So public health workers have the right to appeal any decisions related to disciplinary actions or dismissal to the Civil Service Commission or the appropriate appellate body. So next is discrimination prohibited. So Republic Act number 7305, the Magna Carta of Republic Health Workers contains provisions that prohibit discrimination against public health workers. So discrimination can take various forms and the law aims to ensure the public health workers are treated fairly and with respect. So here are some key points related to the prohibition or discrimination under RA 7305 of discrimination prohibited. Number one is equal protection. So this law emphasizes the principle of equal protection under the law. So public health workers should be treated equally and without discrimination, regardless of their sex, civil status, disability, religion, political affiliation, ethnicity, or other. similar factors. Number two is merit and fitness. So the civil service law rules and regulations which are recognized by RA 7305 emphasize merit and fitness as the basis of employment and promotion. So next is workplace equality. So the law aims to promote equality in the workplace, ensuring that public health workers have a conducive working environment where they are judged based on their skills, abilities, and qualifications rather than irrelevant factors. So next one is understaff overloading or load staff. So in situations here are these are shortage of staff or an excessive workload. Public health workers may face related challenges to their well-being, to job satisfaction, and the quality of health service they provide. So here are some ways in the Magna Carta of public health workers and related principles could be considered in addressing staffing overload or overloading issues. Number one is security of tenure. Two is right to health of workers. Three is healthy working conditions. And four is civil service rules and regulations. So I pass on to the next reporter.
Next is the administration charges. So, administrative charges against a public health worker shall be heard by a committee composed of the provincial health officer of the province where the public health worker belongs as chairperson, a representative of any existing national or provincial public health workers organization, or in its absence, its local counterpart, and as a supervisor of the district, the last two to be designated by the provincial health officer mentioned above. Next is the safeguards and disciplinary procedures. So, in every disciplinary proceeding, the public health worker shall have the right to be informed in writing, the right to full access to evidence in the cases, the right to defend him or herself and to be defended by a representative of his or her choice, the right to confront witnesses presented against him or her, the right to appeal to designated authorities, the right to reimbursement of reasonable expenses incurred in his or her defense, and such other rights as will ensure fairness and impartiality during proceedings.
Next is duties and obligations. So the Magna Carta for Public Health Workers in the Philippines outlines the rights and responsibilities of public health workers. While the document itself is not named Magna Carta, the term is often used informally to refer for Republic Act number 7305, known as the Magna Carta of Public Health Workers. So here are some key duties and obligations outlined in the legislation. So first is right to self-organization. So basically, public health workers have the right to form and join or assist employees' organization of their own choosing for furtherance and protections of their interests. Next is right to collective bargaining. So public health workers are entitled to negotiate with their employees concerning their terms and conditions of employment. Next is right to security of tenure. Public health workers shall not be removed or suspended except for costs and after due process. Right to adequate compensation. Public health workers are entitled to receive just and humane compensation. Right to education and training. Public health workers have the right to educational and training opportunities to enhance their professional growth. Right to safe and healthful working conditions. Employers must provide public health workers with a safety and healthful working environment. And right to occupational health and safety. Employers must ensure the public health workers are protected from hazardous conditions that may affect their health and safety. Duty to deliver essential health services. Public health workers have a duty to provide essential health services to people. Duty to continue public health education. So, public health workers are responsible for the continuous conduct of public health education and information. These points provide a general overview of the rights and responsibilities outlined in the Magna Carta Public for Health Workers in the Philippines. And these specific details or provisions can be found in the actual legislation, and it's advisable to refer to the legal text for a comprehensive understanding. Next. Next is normal hours of work. So, the Magna Carta Public Health Workers in the Philippines primarily focuses on the right benefits and working conditions of public health workers. But it provides certain general principles which specific details regarding normal working hours, as well as other employment terms, may be addressed in broader labor laws, civil service regulations, or agency-specific policies. So, for more details, specific information about the normal working hours of public health worker is recommended to check with the relevant agency. So, different government agencies may have specific guidelines regarding working hours for public health workers. Contacting the Human Resources or Personnel Department of the agency, the question can provide more accurate details. Next is refer to Civil Service Commission guidelines. So DCSC in the Philippines is responsible for setting rules and regulations for government employees. They may have guidelines that address working hours and conditions. Next is review employment contracts or manuals. So public health workers may have employment contracts or manuals that outline their terms of service, including normal working hours. And it's essential to refer to official government documents and policies for the most accurate and up-to-date information regarding the working conditions of the public health workers in the Philippines. Next. Next is salary. So Magna Carta of Public Health Workers, Republic Act 1705 in the Philippines, which outlines the rights and benefits of public health workers but does not specify details salary information. So salary rates for public health workers like government employees are often determined by government regulation, salary grades, and other factors. So public health worker salaries are typically based on the salary standardization law and are categorized into different salary grades. The specific grades can vary depending on the employee's position, level, and experience. The CSC and the Department of Budget and Management in the Philippines are responsible for setting and implementing the salary standards. And for accurate and up-to-date information of salary details for public health workers, it is advisable to refer to salary standardization laws, which respect the latest salary standardization laws and amendments as these outlines the salary rates for government employees, including public health workers. Consult with the Civil Service Commission, as the CSC can provide information on salary grades, rules, and regulations applicable to public health workers. Lastly, is contact the Department of Health or relevant agency, which specific salary details and benefits for public health workers may be available through the health department or relevant government agency employing these workers. So understanding the salary structures and benefits may require referring to official government documents, consulting with relevant government agencies to ensure accurate and up-to-date information.
Next is the additional compensation hazard allowance. So, notwithstanding Section 12 of Republic Act 6758, public health workers shall receive the following allowances: hazard allowance, subsistence allowance, longevity pay, laundry allowance, and remote assignment allowance. Next is additional compensation subsistence allowance. So, public health workers in hospitals, sanitaria, rural health units, main health centers, health infirmaries, barangay health stations, clinics, and other health-related establishments located in difficult areas um, declared under state of calamity or emergency for the duration thereof, which exposes them to great danger, contagion, radiation, volcanic eruption, so occupational risk or perils to life as determined by the Secretary of Health or the head of the unit with the approval of the Secretary of Health shall be compensated hazard allowances equivalent to at least 25% of the monthly basic salary and receiving salary grade 19 and below, so 5% for health workers with salary grade 20 and above.
Next is additional compensation longevity pay. A monthly longevity pay equivalent to 5% of the monthly basic pay shall be paid to a health worker for every 5 years of continuous, efficient, and meritorious services rendered as certified by the Chief of Office concerned, commencing with the service after the approval of this act. Next is additional compensation laundry allowance. All public public health workers who are required to wear uniforms regularly shall be entitled to laundry allowance equivalent to 125 pesos per month, provided that this rate shall be reviewed periodically and increased accordingly by the Secretary of Health in consultation with the appropriate government agencies concerned, taking into account existing laws and prevailing practices. Next, please. Next is additional compensation, remote assignment allowance. Doctor, dentist, nurse, and midwives who accept assignments as such in remote areas or isolated station, which for reasons of far distance or high accessibility, such positions had not been filled for the last 2 years prior to the approval of this act, shall be entitled to an incentive bonus in the form of remote assignment allowance equivalent to 50% of their basic pay, and shall be entitled to reimbursement of the cost of reasonable transportation to and from such remote post or station. Upon assuming or leaving such position and during official trips, in addition to the above, such doctors, dentists, nurses, and midwives mentioned in the preceding paragraph shall be given priority in promotion or assignment to better areas. Their tour of duties in the remote area shall be exceed 2 years, except when there are no position for their transfer or they prefer to stay in such post in excess of 2 years. Next, please. Next is housing. All public health workers who are on tour of duty and those who have unavoidable circumstances are forced to stay in the hospital, sanitarium, or health infirmary premises shall be entitled to free living quarters within the hospital, sanitarium, or health infirmary, or if, su- if such quarters are not available, shall receive quarters allowance as may be determined by the Secretary of Health and other appropriate government agencies concerned, provided that this rate shall be reviewed periodically and increased accordingly by the Secretary of Health in consultation with the appropriate government agencies concerned.
Next is the medical examination. Compulsory medical examinations shall be provided free of charge to all public health workers before entering the service in the government or its subdivisions and shall be repeated once a year during the tenure of employment of all public health workers, provided that where medical examination shows that the medical treatment and or hospitalization is necessary for those already in the government service, the treatment or hospitalization including medicine shall be provided free either in a government or a private hospital by the government entity paying the salary of the public health worker, and provided further that the cost of such medical examination and treatment shall be included as an automatic appropriation in said entity's annual budget.
Next is the compensation of injuries. Public health workers shall be protected against the consequences of employment injuries in accordance with existing laws, and injuries incurred while doing overtime work shall be presumed work connected. Next is the leave benefits for public health workers. Public health workers are entitled to such vacation and sick leaves as provided by existing laws and prevailing practices, and provided that in addition to the leave privilege now enjoyed by public health workers, women health workers are entitled to such maternity leaves provided by existing laws and prevailing practices, and provided further that upon separation of the public health workers from services, they shall be entitled to all accumulated leave credits with pay. And next is the highest basic salary upon retirement. 3 months prior to the compulsory retirement, the public health worker shall automatically be granted and one salary range or grade higher than his or her basic salary and his or her retirement benefit thereafter, and computed on the basis of his or her highest salary, provided that he or she has reached the age and fulfilled services requirements under existing laws.
Next is right to self-organization. So public health workers shall have the right to freely form, join or assist organizations or unions for purposes not contrary to law in order to defend and protect their mutual interests and to obtain redress of their grievances through peaceful concerted activities. However, while the state recognizes the right of public health workers to organize or join such organizations, public health workers on duty cannot declare, stage, or join any strike or cessation of their service to patients in the interest of public health, safety, or survival of patients. Next slide. Thanks. So next is freedom from interference or coercion. So freedom from interference or coercion, it shall be unlawful or any person to commit any of the following acts of interference or coercion. So first is to require as a condition of employment that a public health worker shall not join a health workers organization or union or shall relinquish membership therein. Next is to discriminate in regard to hiring or tenure of employment or any item or condition of employment in order to encourage or discourage membership in any health workers organization or union. Next is to prevent a health worker from carrying out duties laid upon him or her by his or her position in the organization or union or to penalize him or her for the action undertaken in such capacity. Next is to harass or interfere with the discharge of the functions of the health worker when these are calculated to intimidate or to prevent the performance of his or her duties and responsibilities. And lastly, to otherwise interfere in the establishment, functioning, or administration of health workers' organizations or unions through acts designed to place such organization or union under the control of government authority. Then lastly is consultation with health workers organizations. In the formation of national policies governing the social security of public health workers, professional and health workers organizations, or unions as well as other appropriate government agencies concerned shall be consulted by the Secretary of Health. For this purpose, management health workers, consultative councils for national, regional, and other appropriate levels shall be established and operationalized. So that's all, and that ends our discussions about the Magna Carta law. Thank you.